Our lymphatic massage podcast was so popular, we thought, why not talk about Gua Sha?
Yeah, we might as well keep the tissue theme going.
What the heck am I holding here?
That is a Gua Sha tool. This is a tool that we use to do a specific tissue technique to help patients.
Today, we're going to talk about tissue techniques that you can use at home, why Gua Sha works. There's a lot of different benefits that I didn't realize. And Dr. Ron Dummar, the man with the plan, is here to start us off.
Absolutely. I'm excited about this. I think it's going to be something great. I was surprised we actually haven't talked about it yet. We talked about acupuncture. We've talked about a number of different Chinese medicine topics. And I love talking about Chinese medicine because there's so much rich history there. And there's so much that's been carried forward. And we know if you have 1,000+ year history where it's been benefiting people, there's got to be something there. Okay. Also, on top of it, now we do have a lot of really good research coming out that demonstrates how this actually works and why it's beneficial for you.
And you might have heard it called scraping, right?
Scraping. Yeah, oftentimes people will call it scraping, but Gua Sha, actually Gua means scraping, or Sha, and Sha means essentially like a sand or a little dirt. And when we palpate over with our fingers, and you can even feel it as you're moving over with the tool or you're going over the skin, but you can feel a little gristly, or where it's not so smooth, it's like sand. And that that type of sensation we describe nowadays as more of an adhesion, where there's been some sort of injury and a repair mechanism that has taken place, and it hasn't quite properly healed in the same grain of the muscle and tendon.
You're Dr. Ron Dummar, functional medicine doctor here in Heber City, Utah, and so much more. You have a clinic called Community Health and Wellness. The link is in the bio, by the way. And I'm Nick, one of your patients. We've been doing this podcast for a couple of years. Real quick, and then you can get to talking about you, because that's what I want to hear. But I had a foot injury recently, and I had to scrape it a lot. And the whole idea was the blood doesn't really get to the foot very well. And when you scrape it, you send like some kind of message to the body, send blood here, emergency, correct, and that helps it heal.
Yeah, part of it is an immunomodulating response. So essentially we're trying to draw attention to the immune system, draw attention to the autonomic nervous system, the brain. Hey, there's something here that needs to be repaired. And that attention, just doing the scraping and sending the attention there with that activity, that actual manual activity, draws the lymphatic tissue or draws the immune tissue there to help speed the healing and tissue recovery. So you definitely get an increase of circulation and blood flow in that area.
All right, maybe we could talk about the history of it, or talk
Sure.
about your history, but also could we just like showcase what it is and why people should care and how it could help? So I just threw a lot at you there, but I don't want you folks to get bored. I want you to realize we're going to give you some good stuff at home.
Yeah, so these are some things that are great that you can do at home. And when I have, like my kids, I have 6 kids, for instance. And one of the reasons I wanted to talk about this is definitely something that parents can have their kids do, like athletes, sports injuries. Oh, my hip hurts, my knee hurts. A number of my patients that come in, I give them a tool. We'll sell a tool. This is one of the tools we actually give to them right there. And I'll teach them how to use it and what techniques and how to, how firm and everything as well. So we teach them how to use it and then give them those tools so that they can treat themselves when it's needed and necessary. Okay, so I have, for instance, a soccer player. When he strikes the ball, when he's a goalie, when he punts the ball, it hurts his knee. That's when he came in originally. So we worked on it, felt a lot better. He came back. He's like, yeah, it's great, but if I do it too many times again, it comes back. So eventually I said, look, here's a tool. This is how you do it. And now he just manages himself. He comes in very rarely, on occasion, just to get the joints and everything looked at and the muscles to make sure everything's in good order. But he's managing it for the most part himself. And that's what I do with my kids too. I make sure they have one of these in their sport bags. Make sure they have one of this. I show them how to use it, and they're good to go.
Show me how to use it.
All right, let's do this. So one of the things to understand too, we talked about, thousands of year history of Gua Sha, and you can really look back and think even maybe a prehistoric man. We've mentioned that a lot. We like to go back anciently when we're talking about some of these old techniques. But it's like, one of the most common things, I think, intuitively for people to do when there's a sore, ache, or a pain in their body is to rub it or massage it, right? It seems pretty intuitive to do that. And so a lot of our Gua Sha techniques were actually initiated from that idea of, if we rub this or massage it or ultimately improve the blood flow and circulation in that area, we're going to help speed that healing in a better way. So you could use it for lung issues. It's been used for like scraping in between the ribs, right? So intercostal spaces, and you can just scrape. There's a technique actually they call coining, where they'll use actually a coin as the scraper, and they'll go in between the intercostal regions, in between the ribs, and they'll scrape all along there to help benefit the lungs. Now, think about, again, we did our lymphatic podcast. All of those lymphatic chains that run intercostally help with moving fluid in and out of the lung, especially pathogens. And so if you have a lung condition, scraping in and around the rib cage in the back and also on the front would be beneficial for that. Okay. Also soreness, inflammation, any sort of muscle or tendon related issue, it's going to be very beneficial for. So how do we do this? We usually use a oil of some sort as a lubricant.
Okay.
I don't typically recommend that you do it without. I will sometimes, with patients, if they haven't dressed in a way that allows me to expose that specific area or to have a skin-to-skin contact in that area, I will do it over the skin. Over the clothing. So like over the pant or over the shirt leg. And so, but typically what we'll do is we'll use a lubricant. So if we're going to assess ultimately your forearm here, is that what we're going to do, Nick?
Sure. That's what I came in for, the forearm.
And of course,
injury.
We're using here Earth's Medicines cabinets, ozonated olive oil. Okay. And
that's great.
That's made here in Heber City, which is fantastic. We love that. Nice local product. So we'll come right across here. We'll check the muscles and tendons, just palpate them and see if we feel any like little tender spots. Ooh. You can feel that right there.
That's real tender.
Yeah. So what we want to do, that's the sand that was described by Sha, right?
Of
Sha
the
Gua Sha.
Okay.
So that's the sand or the dirt. So we want to come in here essentially and isolate that spot first and go any direction. You can kind of go any direction you want to with that tool. And what you're doing is breaking up that adhesion where that fibroblastic activity is taking place here in the muscle and tendon. And then after that, we're going to go across it with some nice, smooth, broad strokes to encourage it to realign with the fibers of the muscle and tendon. So it's important that you understand that in the arm, it's really easy because all of the tendons and muscle, the grain of them, for the most part, run like this. They run down towards the hand. So it's fairly easy. We do have a few that go like this over here, up closer to the elbow. But most of them in the forearm, you can get away with just doing this. So essentially what we're doing is we're creating, you can see on Nick's arm, we're eliciting this hyperemia or an increase of blood flow is what you're seeing. Sometimes we will see a lasting, even more of a deeper, what we call petechiae, where blood starts coming up. The stagnation is what we're trying to release or remove from the muscle layer down there, that stagnation of tissue. So we're trying to release that, and sometimes you'll see almost a bruise is what we would call it commonly.
Like the redness is not something to be afraid of. That's kind of what you want.
That's what we want.
Yeah,
we're looking for that. Yeah.
And this is not comfortable.
It hurts good.
Yeah,
right?
It hurts good. That's a good point.
Yeah, and that's what a lot of our patients say is they're like, whoa, it's not like I'm going in for an effleurage massage, but at the same time when you're finished, so if we go, so you can feel that spot, feel how that's a lot smaller now and a lot less tender.
Yeah.
Right there. And then even if you move that around, you'll feel an increase in flexibility.
Yep.
So what we've done is we've cleared out that adhesion, those adhesive spots, they're non-pliable. So they actually restrict the motion of the muscle and the tendon. But when we go through and scrape it out, we realign it with the fibers of the muscle and the tendon, and it allows it to work cohesively together as a group again, and you improve flexibility, and you actually get an increase in strength too.
Where can you do this on your body?
So you can do it on your neck, shoulders. You're looking for any muscle. I have a patient who was involved in a whiplash injury recently, doing a motor vehicle collision. He had a significant amount of damage and injury along the posterior rim of the occiput. So I did a lot of scalp Gua Sha for him. working to help clear the inflammation, which is obviously something that Gua Sha can do, because it activates lymphatics. As we're activating the lymphatics and we're pumping out the inflammation and we're activating the immune response, the lymphatics become super active as well. And so it allows that inflammation to be better distributed and circulated throughout the body. And essentially, like we said in the lymphatic podcast, we have more attachments to the gut than anywhere else in the body. So we would want to push it down through the neck, down through the shoulders, down through the back, and down towards the abdomen. So if we're working in the patient's face down, we would do the back of the skull, the occiput, down through the neck, the shoulders, and then down to the back into the lower torso.
Okay. What else? Would you want to tell me how this benefits me otherwise?
Yeah.
I would like, what are these other tools for? Like, or would they just care about this green one?
So this is the simplest, easiest one to do. You can actually, if you have some sort of, like, one of the really great things about Gua Sha and thinking about its ability to reduce inflammation in the body, think about arthritic and inflammatory disorders. So even arthritis in the hands, osteoarthritis, or even rheumatoid arthritis, you can scrape. That's one of the great things about the shape of this tool right here. You can get in between. You can go right on a finger, right, or into the joints of the finger there, and you can even get into the inner bones and the metacarpals in there as well. So deep into the wrist, you can get into there. You can do any of the muscles in the hand. So it's very multifaceted, functional tool right there.
Even if you don't know what you're doing, you can just kind of work on some muscles.
You can, and it's very, so think back to the very original. Obviously, there is a lot of sophistication that goes into the techniques and how to maximize them and be as efficient and as possible. But remember that this generated out of this idea that, oh, this area hurts. Well, let's see if we can scrape it, activate an immune response, draw attention of my mind and my body to this area so that I can hopefully speed a healing or tissue recovery in that area.
Okay.
So yeah, it doesn't have to be super complicated. Doesn't have to be complicated at all. But at the same time, what I like to do is I like to palpate in the region to find exactly, okay, where is that actually bothering me? And I'm surprised as a doctor when I work with people that they don't exactly know where their pain is. Right? They know that it hurts and they know that they have pain. And I ask them, okay, well, show me where their pain is. And oftentimes they're like, well, it kind of hurts. And so we end up looking for, okay, what's really causing the pain? Where's that genesis of the pain? So that's a lot of what I find my job to be.
Yeah. Well, let's talk about the benefits of this. Because, by the way, it's still red. Like, this was no joke.
Yeah, and sometimes you can actually have a little petechiae that'll show up. We talked about that being more of the deeper bruising. If we spend a little more time on that, you may have gotten a little more red dots in there. That can last for a few days, and it will go away. Okay. I actually, early on in my practice, I had a patient come in, and he had been involved in a motor vehicle collision as well. And I did scraping along his spine, his whole back. I did neck all the way down to his buttock and just did the scraping there. We had a really good response. Obviously, he'd been through some pretty traumatic stuff. And so because of that, there was a lot of blood that was pooling. You could think almost like a bruise, but you can't see it topically, but it's stagnating blood in the muscle. And if you have stagnating blood in the muscle and it's heavy, imagine like squeezing molasses through a rag as opposed to just like squeezing water. It becomes very porous and very heavy. And then, so what we do is we go in and we scrape that out. We pull that tissue up into the superficial area where it can be better circulated and distributed throughout the body. And then the patient's like, oh my gosh, I feel so much more relaxed. So typically when people finish with Gua Sha, even though it's like it hurts good, it generally after, it's like, wow, I feel way more flexible, way more relaxed, and a lot less pain than I had before.
When would you do this? After exercising? The next day?
I like to use it if I'm feel like with soreness, or if something's chronically bothering me, if it's been bothering me for a week or two, or if like, oh, If I have patients who come in and we're working on the same thing and it feels better once they get treated, but then they keep coming back in for the same thing, that's usually when I'll say, hey, you need to do a little self-care. You need to do a little home treatment. And then I'll teach them some different techniques and they take care of it at home.
So you can kind of be intuitive with if it's something nagging, try this.
Absolutely.
Okay.
Absolutely. Now, you can alleviate, we talked about reducing inflammation. We talked about the activation of the lymph, alleviating muscle tension. That's kind of like what we were doing with your forearm there. A lot of people are concerned about the muscle tension. I have a lot of people who tell me, oh my gosh, I store all my stress right here. And they point to their traps right there at their, neck and shoulder area. And generally, and we've talked about this, I think, before, but generally I will say to those people that actually they just have poor posture. So posture is a big thing as well, keeping those shoulders back and retracted, where so many things that we do, working at a desk, driving a car, sitting in a chair, in a couch, it creates a roundness of that spine and those shoulders where it draws them forward and then puts extra stress and tension on the shoulders and the muscles there of the neck. So first of all, make sure that you're not leading to perpetuating injury by having poor posture. That's one thing to make sure of. And then secondly, once you've addressed that, then we can say, okay, now let's make sure that there's no adhesions, no potential injuries in there that would be perpetuating that, even if you have good posture. And that's where the Gua Sha comes in, to say, okay, let's release any of those adhesions, that sandy part of the Gua Sha, the Sha part. Let's release that, line up the fibers of the muscle and tendon so that we have improved flexibility and decreased pain. One of the cool things is just an article, I have a quote here. It said, Gua Sha exhibits a more long-lasting anti-inflammatory effect relative to a hot pack. So a lot of people will use hot packs for their pain, but Gua Sha actually gives them more sustained relief, pain relief from it. And they also have improved mobility, they've noticed, in elderly patients with chronic low back pain. So if you're an elderly patient or an aging patient and if you have chronic low back pain or chronic back pain, neck pain, shoulder pain in general, Gua Sha is very likely something that's going to benefit you.
You can do it on your back too.
Do it on your back, your spine, your legs, ankles. You can do it on any muscle, basically. So we work on the skull. I've done it on the chest. Obviously, we mentioned that before too. I've done it on the abdomen, on the abdominal muscles and the rectus abdominis and a variety of different muscles on the abdomen. Any muscle injury or tension, you can utilize Gua Sha for.
And then what about like skin health?
So skin health is actually an area that it's really surging in right now. Gua Sha is so popular. In fact, there's a lot of women, I bet, that are listening to this podcast that may own a Gua Sha tool to do on their face. So to improve blood circulation, microcirculation, improve collagen formation, right, within the body, and to help tone and lift those muscles of the face, a lot of women are doing Gua Sha on their face now because it does improve that microcirculation, oxygenation to the blood, to the muscles and tendons, and it helps with that tone and lift that women want so nicely, right?
How do you do it on your face?
Preventing wrinkles and things like that. So we have different tools specifically that we use, but you can use this simple one as well. You can even use like rolling, like there's a roller tool that you'll use for the face as well. And essentially you come here and we're wanting to go up more in the strokes, but out here on the forehead and out here across the bridge of the nose and over the maxillary bone, and then up from the bottom, from the chin and the jaw. You want to go up all across there in the strokes that you're making. We're not really looking for a deep contact. The idea is not always in the face and the structure of the face or the brow to be digging out adhesions. That's not what we're looking for, unless those actually do exist and are causing pain. Generally with facial Gua Sha, we're looking to improve microcirculation and tone and lift, because you don't want to walk out of the You don't want to walk out either looking like having petechiae or bruise type marks all over your face. That's not what we're aiming for.
And then it's also relaxing, right?
Yes, it's actually very, very relaxing. It promotes relaxation because it releases endorphins from the body. It releases neurotransmitters in the body as well, and allows the nerves to be functioning more adequately. Okay, and so one of the cool things that I wanted to include from this, from an article that I read, a journal article, it said that Gua Sha therapy, and this is, I think, very, very pertinent for a lot of the ladies listening, that Gua Sha therapy effectively improves treatment efficacy in patients with perimenopause syndrome. So Gua Sha is actually a very good and beneficial therapeutic treatment for patients that are dealing with perimenopausal and menopausal symptoms.
Where would you treat?
What we would treat in the abdomen, we'd think about, I would think more in that case doing it more like a lymphatic, addressing lymphatics, and then finding and addressing if there's any specific points that do have adhesions in them on the trunk or the spine. But I would really be focusing on the back and the spine and the neck and the shoulders for the most part.
Is that something that's better to get someone else to treat you versus you try it yourself?
Absolutely. Yeah, that one is probably a little better to have somebody else do. But again, you can do it at home, and you could do the abdominal points, and you could find to see if there's any specific points around your abs or your thighs or your lower back. If it's bothering you, and you grab a tool and you just reach back there and scrape, and that will, you'll receive the benefit from that as well.
What about this guy? It's like a little claw tool. It's like brass knuckles.
Yeah, so this one we use a lot as, one thing I haven't mentioned that we do use Gua Sha for too is to essentially break up and realign fascia. So the fascia that covers the muscle, it looks a little bit, I equate it oftentimes to like tissue paper, or even like face paper of some sort, right? So let's say you get a paper towel, right? And you crumple it up. It's got a bunch of lines on that now. And you open it up, it's flat, but it still has all those folds. All those areas with those folds are areas where there's been maybe an injury or damage to the muscle below that also happen to affect the fascia that covers it. So the fascia sometimes, even when the muscle's fully repaired or the tendon itself, the fascia itself can have these little scar tissue adhesions in them. And we use this tool specifically to help break up those fascia adhesions. And then we will finish it with a nice smooth tool as well to help realign again those fibers with the muscles and tendons. So this is like a fascia release tool.
Did we leave anything out?
I actually think that we got everything pretty well.
Yeah, I'm excited. If they're looking to get one of these tools, where do they get one?
These tools are actually not that difficult to access. However, if you're looking for certain medical grade tools, it might be a little harder to access. But you can reach out to us, and we can get you some of the simple basic tools. Or honestly, you can give Jeff Bezos a call if you want to, and I'm sure he'd be able to. You know what I'm saying? Go to Amazon. Okay, fine. That's there. I see it there oftentimes. Ha ha ha. So they're pretty easy. You can also reach out to there are a variety of different techniques that have been taken up based on Gua Sha. So Gua Sha has been done for thousands of years, but there's techniques that one of them is called Factor. So FAKTR. They have a variety of tools that they'll sell. There's another one. There's another one called Graston, and Graston also. Graston I think came out before Factor, but there's a variety of different. There's a fascia blasting I think as well. So there's a variety of different tools and kits and techniques and methods and modes where they say, okay, this is my approach. This is the way I like to do it, and you should buy my tools and do it my way. Well, the traditional way is the way I like to do it. I like to use ancient and Eastern medicine and move forward in a way that we know, using obviously our modern techniques and understanding of science as well. And so I love to bridge the ancient with the modern and get the very best delivery for our patient possible. So,
with the goal of being well now.
Be well now.
Hey, namaste, everybody.
Namaste.